Hi, this is Dr. Mike Jurgowitz, functional medicine practitioner, and I wanted to spend a few moments to explain a few of the different types of adverse food reactions. So, in my office, we typically test some of the immunological types of reactions. There are also other biochemical or physiological type of reactions. Now, most of my patients that have had testing done in the past, these tests are going to be for true food allergies by their traditional doctor, and these are classified as IgE mediated. Now, the testing that I'm going to do is type 3 hypersensitivity, which is considered IgG. And what's important to note about these reactions, specifically when someone has an IgE mediated or a true food allergy, is these reactions are really relatively low. So most people don't have reactions to those foods, and they typically result from infrequent exposure. And the symptoms are very predictable, and the offending food is obvious because they ingest the food and they have this immediate reaction, which could be a basophil or mast cell triggered anaphylaxis. They're also associated with like histamine and leukotriene release, and the patients are typically aware of the offending food, and the antibodies to these foods are persistent for years. So the treatment for a true food allergy is essentially to have that permanent removal of the food. Now, IgG mediated, this incidence is actually relatively high, and it results from frequent exposure to certain foods. And people typically get these chronic, vague, generalized symptoms. They can be things such as eczema, dermatological symptoms, headaches, brain fog, joint pain, fatigue. So you can't really tie them to any sort of condition. And you basically have this offending food um, that's not being suspected. And it's one of those things that your body makes this immune complex to the food, and IgG is an inflammatory type response, and patients are not going to be aware of the offending food, but these immune complexes typically stay in the body for about 21 days, and they decline within about a month. And so the approach or the treatment is really this elimination of these moderate and highly reactive foods. And but in addition to, we really have to heal the underlying intestinal barrier dysfunction and improve digestion, so we can really kind of clear that immune complex. And many times when people do some of these elimination type diets, they eliminate the food, which basically removes that inflammation, but they're not really addressing this underlying intestinal barrier dysfunction. They're not healing that gut. And many times it's not a 1 or 2 month process that can take, say, 4 to 6 months to see that improvement from a laboratory perspective. Symptomatically, people can feel much better in a short period of time. But if you're really trying to do the long-term correction and to clear the antibodies and to address that underlying physiology and that dysfunction, it takes longer to do that. And many times when people don't do that, you eliminate these foods and then you have that underlying dysfunction still. And then the body's going to start to slowly over time start to make some of these immune complexes to some of the newer foods now that you're eating. So it's really important to work with a functional medicine practitioner to navigate you through identifying, based upon your own biochemical individuality, what foods you can be reactive to, as well as we can test with some of these immunology type labs that intestinal barrier function. And we can look at some of those antibodies to some of those different components. And so we get more than just what the food reactions are. So it's really important when you're looking at not only GI symptoms, but autoimmune conditions as well as dermatological type symptoms, because that tends to be an expression of gut dysfunction as well.